In the world of global health, there is a troubling trend, and it is gaining momentum. Diseases we once thought were under control are making a comeback. These are called vaccine preventable diseases, and their resurgence is a growing threat to health systems worldwide. Vaccines are among the most powerful tools we have to prevent deadly diseases like measles, polio, and diphtheria. However, in recent years, these diseases are resurging, posing a major challenge to global health. But why is this happening? And how can we stop it? According to the World Health Organization, WHO, global vaccination rates have been declining. In 2021, measles outbreaks surged by 80% when compared to the previous year, with nearly 40 million children missing out on life-saving vaccines. This is not just a problem for one country, it's a global issue. The reasons behind this resurgence are complex, but a significant factor is the breakdown in immunization systems caused by conflicts, the COVID-19 pandemic, and the forced migration crisis, and other events that are similar. Imagine being forced to flee your home in the middle of a crisis. Today, that is the reality for millions of people. Every minute, 24 people are forced to flee their homes due to violence, disaster, or persecution. And of those displaced, over half are children. These displaced populations, living in crowded camps or moving across borders, face a host of challenges. Perhaps the most urgent being access to vaccines. You see, whether we're talking about a refugee camp, an internally displaced persons camp, or border regions where stateless people roam, health services are often overwhelmed, and access to routine services such as vaccinations becomes very limited. And this creates a perfect storm for the spread of vaccine preventable diseases like polio, measles, and cholera. 1 in every 5 people in the world today is living in a fragile setting where health services are not only stretched thin, but are often non-existent. And for children who have been deprived of vaccines, the risk is even higher. What's the result of all of this? Well, the result of all of this is an increase in outbreaks of diseases that can easily be prevented. For example, in the conflict zones of Syria and Yemen, measles and polio cases have spiked in recent years due to disruptions in vaccination programs. And the impact of these diseases extends beyond the immediate health crisis. The resurgence of vaccine preventable diseases places immense strain on already fragile healthcare systems, pushing them to the brink. Hospitals are overwhelmed. Healthcare workers who are already stretched thin are now faced with an additional burden of preventable diseases. And vaccines are not just a prevention tool. They're an investment in a healthier, more stable future. According to the Vaccine Safety Initiative, for every $1 spent on immunizations, the return is up to $44 in health and economic benefits. But this return on investment is at risk if we do not prioritize vaccine access for all, especially the most vulnerable, displaced children, and communities in crisis. Global vaccination campaigns are working hard to catch up with the gaps in immunization. Programs like Gavi, the Vaccine Alliance, and UNICEF are stepping up to provide vaccines in conflict zones and refugee camps. But these efforts require funding, coordination, and a global commitment to ensuring that every child, regardless of where they are born, has access to life-saving vaccines. So why should you care about vaccine-preventable diseases and the forced migration crisis? Because the health of the world is interconnected. Every time a child misses a vaccine, every time a disease spreads unchecked, it poses a threat, not just to that child, but to all of us. By supporting global vaccination efforts, we can protect vulnerable populations, strengthen health systems, and ensure a healthier future for all. The fight against vaccine-preventable diseases is far from over. But together we can help make sure that no child is left behind, and that the world remains safe from the resurgence of these preventable illnesses. Thank you for watching my video. Together we can make a difference. If you're really passionate about making a real impact on global health, I want to invite you to join the Data to Decision school community today. You can learn from experts, share ideas, and become part of a network of individuals committed to solving global health challenges, including the fight against vaccine-preventable diseases. Let's turn data into decisions that change lives. Click the link below to check out our community.